Good afternoon. My name is Esmeralda Painter. Thank you for taking the time to meet with me today. We will be going over cancer nutrition therapy. We will review about how to prepare yourself nutritionally before chemotherapy, nutrition during chemotherapy, and nutrition after chemotherapy ends. At the end of the presentation, I will review some quick reference sheets I created on this topic. Before we get started, I want to review why adequate nutrition is beneficial during treatment. Adequate nutrition during cancer treatment is essential due to the increased needs that your body has of calories, proteins, carbohydrates, and fat. Meeting these increased needs will help your body tolerate the treatment-related side effects of cancer treatment. It will also help you heal and recover faster. Maintaining adequate nutrition during this time can also help you keep up your strength and energy to help you feel better. For nutrition before chemotherapy, here are some things to focus on. Learn about your treatment plan, whether it's surgical, chemotherapy, radiation therapy, or a combination of some of these. Ask your doctor about how you might feel during your treatment. Stock your pantry and freezer so you won't have to shop as often. Include foods you know you can eat even if you feel sick. Talk to your loved ones about ways they can help you through this process, such as with shopping and cooking. If your cancer treatment requires radiation to the head and neck area, you might need to feed through a tube that goes into your stomach, since the radiation can make it hard to swallow. Here in this stage, we want to essentially prepare ourselves. Here are some essential items about nutrition during treatment. We want to include colorful vegetables and fruits since these contain many natural health promoting substances, at least 2.5 cups of fruit and vegetables per day. Your nutrition needs go up during treatment, so to meet these you will require higher calorie and protein intake. We want to try to stay at a healthy weight and stay physically active with activities you enjoy doing. And again, during cancer treatment, your body needs extra calories and protein to maintain weight and to heal as quickly as possible. Snacking will help you meet those higher needs. If you are losing weight, snacks can help you meet those needs. Eat a variety of protein-rich snacks that are easy to prepare. Here's an example of some quick and easy snacks that are high in calories. Some of these can be high in protein, such as the yogurt with granola and the homemade smoothie if you were to add protein powder. This is just a short list. Towards the end of the presentation, I do have some more examples. In this slide, I include 4 ways that can help you increase your calorie and protein intake. Eating several snacks throughout the day, such as in between meals, after breakfast, before lunch, or after lunch before dinner. Another tip is drinking high calorie, high protein beverages such as milkshakes, and also incorporating protein powder into these can help increase protein. The next tip is eat every few hours and not waiting until you are hungry. And lastly, going for a walk or doing light exercise before a meal can help stimulate and or increase your appetite. Here's a slide with examples of high protein foods to include in your diet. We have milk products, meat, poultry and fish, legumes, nuts and seeds, as well as eggs. And in this slide, we have examples of high-calorie foods to incorporate into the diet. We have butter, milk products, salad dressings, and sweets. A topic I wanted to discuss due to its major importance is your immune system. Cancer and its treatment can weaken your body's immune system. As a result, your body cannot fight infection and disease as well as a healthy person can. Here are some ways you can help your immune system. Wash your hands with warm, soapy water for at least 20 seconds. Keep hot foods warmer than 140 degrees Fahrenheit and cold foods colder than 40 degrees Fahrenheit. Do not thaw out meat at room temperature. Thaw in microwave or refrigerator. Wash fruits and vegetables before peeling and cutting. Cook foods to correct temperature. Use a thermometer and place in middle of thickest part. Do not eat at salad bars, buffets, potlucks, or sidewalk vendors. And finally, do not eat raw fruits and vegetables when eating out. Now we will review some different symptoms you might experience during cancer treatment. You might notice appetite changes, such as decreased appetite. Snacking throughout the day instead of having 3 large meals in one day to make it more manageable. Make eating enjoyable by eating with someone or try watching TV as you eat. Be as physically active as you can since it can stimulate your appetite. For constipation symptoms, if it's okay with your cancer team, try high fiber foods such as whole grain bread, cereals, fruits and vegetables, and dried beans. Add them slowly to avoid bloating and gas. Extra fluids such as warm beverages can help. With diarrhea, we want to avoid fried and greasy foods. High fiber foods can make diarrhea worse. Once diarrhea has stopped, you can slowly restart eating foods with fiber. Do eat high salt foods such as broths, soups, sports drinks, and high potassium foods such as fruit juices, potatoes with skin, and bananas. Drink at least 1 cup of water after each bowel movement to replenish lost fluid. Taste and smell changes can occur, so use plastic forks and spoons, try new spices, and eat fresh fruits and vegetables instead of canned. This slide is a continuation of other symptoms you might experience. For mouth dryness and/or thick saliva, drink 8 to 10 cups of liquid per day. Eat soft, moist foods. Eat soft cooked chicken and fish. Enjoy popsicles. Avoid foods that stick to the roof of your mouth, like peanut butter. Moisten foods with broth, sauces, gravy, creams. For sore throat, we want to try and eat soft, bland foods. Avoid tart and acidic food and rough textured foods like crackers, toast, chips, and nuts. Keep away from alcohol, caffeine, and tobacco. For nausea, try to eat 6 to 8 snacks and/or small meals per day instead of 3 large meals. Don't eat foods that have strong odors, are hot, spicy, overly sweet, greasy, or fried. And lastly, for swallowing problems, for this, your doctor may refer you to a speech therapist. Follow speech therapist instructions. Eat small, frequent meals. Use liquid supplements. Chop or cut up food into consistency you need. Most side effects go away after treatment ends, but some may last for some time, so keep following advice and tips to help reduce these. Eat nutritious, balanced meals. Eat at least 2.5 cups of fruits and vegetables daily. Citrus fruits, dark green and deep yellow vegetables. Decrease the amount of fat in your meals by baking or broiling food. Limit your intake of red meat to no more than 3 to 4 servings per week. Choose low-fat dairy products. And finally, limit alcohol intake since it is a known cancer-causing agent. And this is a source that I gathered. The information I presented is here. It is a free resource by the American Cancer Society. Lastly, I wanted to present the handouts I created on high calorie, high protein tips for weight gain, since weight loss is a major issue in those with cancer or are undergoing cancer treatment. It is essentially a review of what I just went over. And here are some more suggestions for adding extra calories and extra protein. Finally, here I have a 1-day sample menu for high calorie, high protein menu with possible snacks included. Please leave me a comment in the comment box below if you have any questions And if you would like to receive these handouts, just email me on my email. I'll leave it down in the description box, and I can happily send you over this PowerPoint and all the handouts and resources that I used for this presentation. Thank you for your time.